Hello, everyone. My name is Jihan Mohammed. I graduated from Bellevue College in 2010 with an associate in radiologic technology. I have been an MRI technologist since 2010, and I enjoy my chosen profession. The purpose of this quality improvement project is to enhance the safety of MRI as a diagnostic tool for patients with ferromagnetic implants in a consistent and expedient manner via electronic application of an improved implant and screening checklist. MRI screening forms are used to improve, standardize, and communicate safety processes. I propose that adopting and implementing this computer-based procedure will afford an increase of quality of care, accountability, eliminate variations in the checklist adherence, and reduce missing or incomplete data entries. Current protocols in my department simply require the MRI technologist to do a time-consuming search and interview by reviewing the patient's medical history, looking for indications of past surgeries, and imaging history to confirm the presence or absence of an implant. This alone is unsatisfactory as the patient may be treated and scanned at another facility and access to those records are not available. Due diligence needs to be exercised by all MRI technologists when performing MRI scans. MRI-based screening forms are either filed in the patient's medical record, archived, or disposed of after a specific period of time, thus becoming inaccessible to technologists in the event of any future MRI requests. With this project, I will update and streamline the existing MRI safety screening process as it relates to implant devices by interrogating a more relevant and implant screening checklist. This checklist will include identifiable and actionable information that can be stored and easily accessible via electronic healthcare record system, which will significantly reduce and serve as a valuable resource for MRI technologists. MRI is a growing imaging modality and has become the standard of care for diagnosis of many healthcare conditions. However, due to the composition and makeup of certain implant devices, MRI as a diagnostic tool may be contraindicated in patients who have implants. Several implant devices are compromised of ferromagnetic material and can result in an induced current and heating from the radiofrequency magnetic field, which can cause severe tissue damage and image degradation. According to the FDA, denial of MRI scans to patients based on the presence of implant devices creates a healthcare disparity and may result in delayed care, misdiagnosis, increased invasive testing, and possible harmful effects from ionizing radiation and contrast media. Modification to the MRI screening form. To avoid denial of care or substandard care for these patients, I am proposing a modification to the MRI paper-based screening form that will provide a timely alternative diagnostic options for patients with implants. Within the radiology department, certain MRI practices treat the presence of implants as an absolute contraindication for MRI scan. This is due to lack of knowledge and understanding regarding the different types and characteristics of implants. This creates waste and highlights a defect in the current process. Adoption of an implant-specific computer-based MRI checklist will eliminate confusion and increase implant patient access. This will eliminate waste and be a valuable resource and tool for the MRI department. This electronic screening form will include MRI classification and scanning parameters. There are currently three universal MRI classifications. MRI safe indicates an implant device does not pose any hazard to the magnetic field and is symbolized by a green and white icon. MRI conditional indicates the implant device does not pose a potential hazard to the magnetic field as long as specific conditions are met. And MRI unsafe indicates it is absolutely not safe for the magnetic field. Needless to say, MRI technologists should be fully aware of these classifications when confirming the presence of implant devices and also knowing when to proceed or not to proceed with the MRI scan. A survey regarding the utility and benefit of an electronic checklist was developed and presented to 25 fellow MRI technologists and 30 random implant patients. Each person was identified and asked to provide specific information to adequately characterize the ease of use, effectiveness, and timeliness before implementation of the electronic checklist in the EHR and after implementation of the checklist. 97% of MRI technologists surveyed found it far more efficient and expedient to generate the checklist from the EHR database rather than the paper-based process. 97% of the patients surveyed used this information process as an opportunity to improve their health literacy and to increase their knowledge and competency in navigating through the EHR system, and believed that implementation of the electronic checklist played an integral role in adequately preparing them for future MRI exams. Most of the participating responded cited functionality, such as ease of use, simplicity, and speed as the primary attributes of the electronic checklist after implementation. Overall, user surveys were satisfied with the impact of the electronic checklist and had on improving the imaging process. Okay, guys, welcome to Epic Hyperspace Radiant. So on this screen provides the MRI technologist or nurse with easy access to the MRI screening form and the implant tab. So once you click that button, it takes you to this electronic checklist documentation form in the patient's EHR. It has 32 pertinent questions relating to the scan. So once the screening data entry is complete, the MRI technologist verifies if the scan is allowed to proceed or not. So here's a closer look of the EHR implant documentation screen. Here, the documentation of the make, model, implant device, and any other pertinent information such as parameter scanning, time limits, proper coil utilization, and MRI classifications can be entered here. But personally, I would still conduct a research of the implant device by either going online or contacting the manufacturing directly. As you take a closer look, you can see that the MRI technologists classified this implant as an MRI conditional device. After implant information is well documented in the patient's chart, you will note to the left a tab for patient implants. With future MR exams, the list of implants will be directly accessible for medical staff and technologists to view without having to search the entire record for the implant. Patients have access to the electronic screening form via MyChart, where they can complete this form prior to their MRI appointment. Once the patient completes the form, the technologist will see on top, copy patient's answers to complete the screening form. The idea and thought process utilized for my concept was gained from knowledge and understanding of health information system for a healthcare manager, HCML 310, a course I completed at Bellevue College in the spring of 2019. Learning about health information system and their use gave me insight into a better understanding of EHR system such as Epic, which is in use at my current employment today. Implementation of the electronic checklist in the EHR system has led to significant decrease in patient wait time and an increase in diagnostic efficiency and productivity. The overall safety of patients with implants have increased and afforded greater access to patients who were previously denied or had limited access to MR imaging as a diagnostic tool. Healthcare facilities that adopt and transition into an implant specific computer based checklist over a paper based screening form will eliminate confusion and waste that would normally delay patient care. Additionally, availing MRI technologists of this software update by allowing the electronic recording of patient implant data is an opportunity for transformation in the delivery of healthcare in MRI imaging. The purpose of this project is quality improvement through evaluation of the current and proposed imaging practice to help improve the quality of patient care and safe access to appropriate diagnostic imaging within the radiology department. Last but not least, this is to acknowledge all those who this project wouldn't have been possible. I would like to thank everyone on this list and express my deep and sincere gratitude to my research mentor, fellow MRI technologist, Swedish managers, and Jennifer. For this, I will always be grateful. This concludes my presentation, and thank you.